Today for Mental Health Awareness Month, I want to raise awareness about anger, which is increased in the pandemic. It is a very common human emotion, a normal emotion, which is not productive, and therefore it is good to raise awareness and to manage it. First, to say a little bit that anger, as I already mentioned, is a normal emotion to different circumstances that are either unacceptable, one cannot control, and it can cover a range of other emotions such as helplessness, guilt, or embarrassment, or fear, or envy. However, excessive anger may be present in many psychiatric disorders such as bipolar disorder, depression, intermittent explosive disorder, in dementia, in addiction. Also, anger and irritability could be present in autism. Just to name a few, this is not intended to be a comprehensive overview of anger, just to raise awareness. And therefore, the appearance of anger is a signal that something is not right and it should be managed. Also, anger can be very damaging both for the individual who expresses it. It ultimately can have very detrimental effects on the cardiovascular system, on the immune system, and also it has detrimental effects for the person who it is directed towards. And therefore, it's not a productive emotion, and different ways should be adopted, both even mainly without medications, but whenever there is a disorder, it's also good to use medications to try to transform the anger into something more productive. And for example, some ways which don't involve medication are meditation, self-awareness, calming techniques such as mindfulness, compassion, spirituality. Also, calming teas could help, and different types of medications exist, such as selective serotonin reuptake inhibitors, some anticonvulsants, propranolol that can be used to manage anger. However, new medications are needed to be developed. And to say something that I learned about anger from one of my patients, psychiatrists and medical doctors learn the most from their patients. Generally, I'm a person who does not get angry at all. And I have been taught since a little girl by my mom that it's not right to be angry, and it's not good for a girl and a woman to get angry. And so I had one patient, I will say not her real name, Mary, who had an irritable depression, and she was in a depression study, treatment clinical trial, and She often got angry. Once she was asking me question after question, and I answered her calmly all of the questions. And at one moment, she got so upset and said, "Oh, Dr. Yusunova, you're impossible. You make me so angry. I was trying to upset you, but nothing can upset you. I give up." And I told her, "Mary, I'm not supposed to get upset because I'm your doctor, so you have a problem, depression, so we have to treat it." This made me think that in the non-hospital world, you don't know what the motives of people are. Maybe they're trying just to test you and to make you angry. Maybe they feel an anger and that's a way of expressing it. So it's always good to step back and to assess calmly the situation and not be reactive. I looked up the neurobiology of anger, and it is connected to the stress and also to the immune system, so further studies are needed on the brain regions that are involved because we don't know a lot, and on different medications that can target the immune system, the stress response, and ultimately to manage this unproductive emotion. Thank you.